First of all, thank you very much for the opportunity to speak here for a few minutes. I know we're running out of time, but I just wanted to bring things back to looking at the roadmap for dementia clinical research in Pakistan, which is something we developed as a number of us already back in 2018 and released in 2019. And I thought it would be quite nice to look back to see what have we achieved and where are we right now. And you can see a number of the people on this list are people here today. So I'm just going through very quickly the key headlines and the key recommendations from the roadmap to just highlight some of the things that we've moved forward on. So the first issue that was raised from the roadmap was about raising public awareness and understanding. And I think that's a theme that's come through multiple times today. Now, I think a very important point about this, of course, is that the roadmap knew nothing about COVID-19. It didn't take that into consideration. And so we have a whole new bunch of issues to deal with, which was so rightly pointed out. And I think particularly when in regards to the impact of COVID-19 on older people and the attitudes and the stigma around it and how that's being dealt with needs to be taken in consideration. So it's great to hear that there is a report that has been released about this specific to Pakistan. But COVID aside, there are a number of initiatives which have, of course, come out and are extremely important and are developing momentum. One of them, for example, is the World Alzheimer's Days activities that have been promoted by Alzheimer Pakistan in a fantastic way and really taking momentum and getting high-profile policymakers behind it. Now, this is from 2019, but the same thing happened in 2020, and having champions moving forward the agenda in terms of understanding and public awareness is absolutely crucial. Other things, for example, research findings about awareness, stigma, understanding at local levels regarding dementia and older people's mental health are absolutely important. And the next step would be to follow up on these reports and take the findings one step further. The other huge issue is about prevention, identification, and reduction of risk. And the focus really has shifted significantly into this area with regards to older adult mental health, even in the last 2 years. Now, most people will be aware of the Lancet report that came out in 2018, and this was led by Joel Livingston. And this has now been updated in 2020, and a number of different risk factors added. And I think the absolute key point here is to recognize the number of risk factors that impact here in Pakistan and the potential for improving older adult mental health by addressing these risk factors. And I'll just go through them very quickly, because another point here is that if we address these risk factors, which shouldn't be beyond what we're able to do, then upwards of 56% of dementias might be theoretically preventable in lower and middle income countries. In high income countries, that's about 40%, but actually it has greater impact in high income countries. And these risk factors, which many people will be aware of, which are the 12 risk factors, include lower education, midlife hypertension, obesity, and diabetes, alcohol consumption, traumatic brain injury, which is one of the new factors that has been added. And of course, that's a huge issue in Pakistan in terms of the number of people who do not wear head protection on motorbikes. Late life depression, I'm not sure that we know much about that, and the data are missing and need to be improved here in Pakistan. Physical inactivity, a very big issue for older people over the age of 60. Smoking. Air quality, again, another new issue. We raised the issue of environmental aspects. Yes, we talked about disasters, but as Professor Zaidi rightly pointed out, there are many other aspects that are, we're facing on a day-to-day basis, and air quality is one of them. And here we do bring in COVID because of social isolation, hearing impairment, and other risk factors. So these are all the things that we need to be thinking about. And one of the ways that we can move forward, and this relates to our most recent speaker talking about the data, is by doing things such as developing a longitudinal study of aging. And a number of us have been working quite hard over the past 6 months to develop the PAC-AGE study, which is the Pakistan Longitudinal Study of Aging, so that we can look over these factors and look for the risk factors for mental health and older adult brain health issues over a period of time. So we're now in the stage where we've developed a protocol, and we're looking for funding to pilot this across the 6 regions in Pakistan. Other initiatives, for example, include the CLICK study. Now, this is a COVID-related initiative in which we have a large-scale global survey of loneliness and social isolation, looking at the impact on care partners of people with dementia. And it's quite a rich data set. So from Pakistan, we have about 1,500 responses, of whom nearly 400 are care partners of people with dementia or long-term illnesses. And we will be starting to analyze these data to try to inform the conversation. And this is in an Urdu and an English version, and we are still soliciting responses up until November 16th. So I think this is, again, a very nice response to some of the highlighted aspects of the roadmap. So moving back to the roadmap, quality of care for people with dementia and their carers. Again, this relates back to the CLIC data that we've just been talking about, but many of these things are captured in the National Dementia Strategy, which you've already heard about. And I think we're not quite there, but almost ready for the launch, as I understand it. And when that happens, hopefully that will add to the agenda and feed into the summit as well. The next issue was about delivery of care and services, also about diagnosis, about interventions, both pharmacological and non-pharmacological, and also progression of normal aging. All of these, again, were raised, and I'll just highlight some of the outputs, and there are a few more, but I'm pointing the finger at a few. For example, intervention studies have been the Miracle Study, which is a feasibility study of Montessori intervention for people with dementia, SenseCog Asia, which is a feasibility study of hearing and vision, and a few other examples. But I think the point I want to make here, going back to my very first comment, is that we need to be careful that we're not getting stuck in pilot studies and feasibility. And the key issue is that we move fairly rapidly to implementation studies, because that's the only way that any of these interventions can actually make a difference to people on the ground. So I think I'm going to leave it there, and any comments or suggestions. But I think my final comment is that initiatives such as the summit are absolutely fantastic. And the conversation is moving forward. It's gaining momentum. And I think in terms of looking at the roadmap after 2 years, some significant gains have been made in terms of older adult mental health. Thank you very much.